So, if we can reach our goals as simple as that, then it's only going to be a short walk, but it's not. The rare disease field is attracting more and more new dedicated people, many sitting in this very room. So therefore it may be useful to remind that just 15 years ago, people living with rare diseases in Europe were ignored and isolated. The constant struggle of families to cope with incredibly tough conditions and their cry out for help all took place in the dark. Well, I have some problems here. It's going to be this one. Yeah. So, thank you. Today, rare diseases are recognized as a public health priority, and EU actions bring concrete results to rare disease patients while providing a blueprint to other regions in the world. Based on the last 10 years of robust success, we can move ahead to new perspectives to achieve even more tangible results, and this in order to improve survival and quality of life. Rare diseases are an EU public health challenge with high unmet needs, thus presenting, to use the kind of words which you find inside EU programs, a health threat and a high community added value. It's a health threat because the vast majority of rare diseases remain untreated or untreatable. We continue to see significant delays in diagnosis, and we see huge discrepancies in access to treatments both between and within member states, even to marketed orphan drugs. But rare diseases also present a high community added value because each disease population is small, the expertise is scarce and widespread, but does exist. The rarity requires to pool patients and expertise, to share resources and develop common tools, registries, data, biosamples, guidelines, enhance dialogue between researchers, healthcare professionals within the social and educational field, patient groups and policymakers. We are facing a huge challenge, but happily many stakeholders have come together to build a unique, integrated, comprehensive and long-term strategy. This has been addressed through a regulatory framework, the EU Regulation on Orphan Medicinal Products, the EU Regulation on Medicinal Products for Pediatric Use, the EU Regulation on Advanced Therapies, and a favorable policy environment, first and foremost the communication from the European Commission and the Council recommendation on an action in the field of rare diseases. And now we also have the EU Committee of Experts on Rare Diseases. The EU Directive on Cross-Border Healthcare provides us with a legal basis for European reference networks. It provides us with better access to mobility of patients, to data and to expertise. And we also now see through the different programs and initiatives a strengthened EU cooperation on health technology assessment. And with the new upcoming Health for Growth program, we will also see the possibility to sponsor a great number of new interesting projects. With the Horizon 2020 program on research and innovation, I think we will expect even more support for research. The priority is that this political and legal framework and these programs translate into concrete results with politically supportive environment, with adequate funding at both national and European levels. So our next step will be to turn this strategy and robust policy base into reality through the EURORDIS technical guidance and through support with structured networks. Here we operate with two key initiatives. First, as already mentioned, the national plans, where we will soon embark on a second phase of development, and with the EURORDIS, which will provide coordination and stimulate sharing of experience, reflection, and new initiatives. With the creation of the Joint Action on Social Services, this will also start reach out to social dimensions of health. Networks will support research and development and ultimately improve access to drugs, recently strengthened by international mobilization of resources through the ambitious EURORDIS collaboration, which has set a target of reaching, through international collaboration, 200 new drugs by 2020. Initiatives in this field must respect the national competences while making optimal use of coordination between member states. And the opportunities created by EU cooperation, and in particular the new EU Programme on Health for Growth and the Horizon Programme, will lead us to innovative solutions. So in conclusion, the rare disease community is ready to meet the challenge of demonstrating rare diseases as an area of high innovation, and thus trying to limit the risk of important disparity in the budgets allocated to rare diseases in member states, especially in a context of economic crisis. The EU collaboration is more than ever needed to narrow the gap between regions in Europe and limit the impact of shortage of resources, with the aim of ensuring quality care for rare disease patients everywhere in Europe. We will continue to emphasize that a structured involvement in rare diseases provide innovative solutions for the organization of the healthcare systems and the optimal use of resources, and health for growth through the development of medicinal products and other therapies. All this with the aim of giving our contribution to a Europe, a social Europe, where the needs of citizens are priority number one. I'd like to thank the EU Commission, you, John Daly, for your continued support to this struggle. I'd like to frankly congratulate ourselves and DIA with the excellent collaboration preparing for this meeting. And I wish you a fruitful sessions and discussions over the next 2 days. Thank you.